Hello friends, I'm back again to the same topic. Biologics, the hot topic. It is the hot commodity in ankylosing spondylitis, and I want you to understand the reality of biologics. So in part 1 you have seen that what are the biologics, what are different kind of biologics available, and how and when biologics are used, and what are the alert signs before using biologics, right? So now let us come to the most important topic. So biologics will increase risk of infection and increase risk of tuberculosis, hepatitis, increase risk of blood cancers, lymphomas, other cancers, and increase risk of lowered immunity, infections because of lowered immunity, and increase risk of other diseases because of immunosuppression. Now there's so much of risk. Plus, added to all these things, when you are taking NSAIDs and steroids, and you are taking methotrexate and biologics, you always carry a very high risk of kidney failure, liver failures, and cancers, as I already told you. So, are biologics worth the risk? Let me put the question straight. Are biologics worth the risk of life you are taking? No, my dear friends. If you are absolutely on bed, nothing is remaining. If you want to take biologics for few days to come out of it, great. Go ahead and take it. But if you are already mobile, if you are already walking, if you are already doing your normal things, you ideally should refrain, avoid taking biologics. Now, why? All the treatment should actually be weighed according to the benefit and risk ratio. If you see benefits to be more, take it. If you see risk to be more, avoid it. Very simple. I am completely here concerned about your safety. If your problem is this and risk is this much, don't take it. Because for solving a simple problem, you will be inviting a complicated disease. Let me put it again other way around. If you are going to treat your mild to moderate ankylosing spondylitis or moderately severe ankylosing spondylitis with biologics, you may get initial relief. Great, but it is a temporary relief. If you take it more and more, you may get complications faster. If you are going to go into remission, you will know it very fast because the response will be that much, right? Response will be that much strong. And then if you're not going to go, or if you're going to get a repeated recurrence, that can be dangerous for you. Now coming to the treatment, the question which Vakas asked, Vakas says, thanks for the explanation. I'll be joining the program soon and waiting to talk to you. Hi Vakas, I will love to talk to you and I will love to help you out of this disease. Just understand, everybody please understand, if disease is genetic, treatment should be genetic. Simple. Now the question is, can genes be reprogrammed? Answer is, epigenetics says it can be reprogrammed. Anyway, you and all over every person in the world is getting his genes updated, upgraded, remodulated, rechanged every 10 to 15 years. If you see your face 10 years back, 20 years back, you are completely changed. Whereas face is reflected by your immunity. So your immunity is constantly upgrading. Your immunity is constantly in change. Here is an opportunity to give them the right signals. What we do by genetically targeted medicines, we actually change these triggers. Let me just explain you. For example, your immunity is going to change anyway. It is going to change in this direction. Our genetically targeted medicine will change the direction, and now your genes will change this way. Because if your genes evolve this way, ankylosing spondylitis will stay with you forever, right? Because this is a changed version and this is going to go ahead, because nothing have been done to change this course of a disease. Now with genetic targeted medicine, we change the course of development and you evolve as a person in this direction. So once you evolve in a completely different direction, your disease will completely change. So if you really ask, if you want to call something as a disease modifying agent or suppressing agent, it can be called as DMRDs or maybe biologics. But if you call something as removing the internal tendency for a disease, that is genetically targeted medicine. And if internal tendency, the ground, the soil has been removed, no plant can grow. Similarly, if the genetic structure is changed completely to new, disease cannot survive. And I want you, all of you, to enjoy that phase of life when you don't have disease. Now, this I am not just talking, it is not a talk. First, I have cured the cases. So, I have cured cases of ankylosing spondylitis, and then I get the right to talk about it, isn't it? If I do not have any cured case, should I talk about it? Common sense, right? I shouldn't. But if I have already have a cured cases of ankylosing spondylitis, I hold the right to talk about this, and I'm talking from the real experiences. I posted some videos on YouTube as well. So one thing which I talk about and we team as a team do about is cure. We try to cure it completely. Another thing, amazing thing which we usually always get right in the early phase of the treatment is the reversal of disease. Now this is something amazing. If possible, try to understand this. Many of the people ask me, what is reversal? How it exactly happens? Let me tell you. For example, just imagine there is a person named A. If we talk of his journey of disease, he says, earlier I used to get a disease X. Then it was suppressed and then I got Y. Then it was suppressed and now I got ankylosing spondylitis. Reversal means ankylosing spondylitis going completely away and Y coming back. Then Y going completely away and X coming back. This is something which is called reversal. Person is going down the line in his past. If you see most of our videos of testimonials, most of the patient will say, I am feeling 20 years younger. I am feeling 10 years younger. And just imagine, dear, a 20 years younger you never had ankylosing spondylitis. A 10-15 years younger you never had ankylosing spondylitis. We want you to travel back in the timeline. We want you to travel back in the timeline, and it will be so amazing. Your energy will be of that phase. Your activity, your diseases, your health will be completely appropriate to 10 to 20 years back. This always happen. If somebody still have a doubt, please just write the comment. I will post videos how a person of 67 years is feeling of 29. How every person says us, I am feeling younger. It is not just a feeling. He actually changes genetically to a young age. So this will be amazing tool. Genetically targeted medicine will be amazing tool to feel younger, get younger, and be younger from inside. So I welcome you for any questions if you want to ask. If you are seeing this on YouTube, please share it to maximum. YouTube or Facebook, you share it to maximum so that most of the people understand the risk associated with this. Most of you are on so many groups, and if you are on so many groups, it is our moral duty to help people know about what is ankylosing spondylitis and what are the myths and realities about biologics. So thank you guys. Thank you for watching this video till last. And if there are any questions, I would love to respond. If you want some particular videos, please Just give in the comment. We'll prepare some special videos for you. Thank you. Bye bye. Take care.